Hi, my name is Dr. Pecoraro. I'm a chiropractor in Scotch, New Jersey. And this video is about what a chiropractor can do to help you. Now, chiropractors work with, what we do is we adjust the alignment of the bones. And we do this especially in the neck and the back. And we do it to relieve pressure on the joints, the muscles, and discs, and the nerves. Now, what does that mean to you? Well, let's say a person has pressure on a joint because of a bone that needs to be adjusted. The alignment needs to be adjusted. Now, this person will generally feel discomfort right in the spot. So if you move and it feels worse in one particular spot, either in your back or your neck, then that's usually a chiropractic problem. Any of the things that I tell you today could be caused from other problems, but they're notorious for being chiropractic problems. So a joint hurts in a spot, you move, that same spot hurts worse. Okay, let's say a muscle. Let's say there's a pressure on the muscle from the bone not being aligned correctly. Well, in this case, if it's a muscle, you'll go to move and your pain will sort of spread out. So it'll hurt right here, you go to move, and now you'll feel it in more places. It'll be wider range, let's say. And remember, this could happen in your back or your neck, because almost everything you see in the back and the neck of a person, that's all muscle. Now let's say you have pressure on a disc. Well, most of the time when a disc has pressure on it, you'll have difficulty moving at all. It'll just hurt a lot, no matter when you move, no matter how much you move. Pressure on a nerve. This is a little bit more complicated, but basically, some nerves are well known for getting pressure from chiropractic problems. And a couple of these would be headaches, sciatica, numbness and tingling either in the arms or the legs. Now there are others, but these are some of the main ones. There are other kinds of nerves that will go to the organs, and they can be affected also. Now with those nerves, you may or may not be able to tell if they're being affected by a chiropractic problem, or if a chiropractic problem is affecting them, because it's just not as well known, not as well studied. But it can still be affected. Now, whether or not they're affected in your particular case and how much they're affected, this you may not know until after you've already started treatment. Sometimes you'll know, sometimes you won't. Now, there are other kinds of nerves also that can be affected. Some of these are called motor nerves. Now, motor nerves, if they're affected, you'll either lose strength or coordination in any of the muscles. And remember now, these muscles don't have to be in the back or the neck. The nerves from the back of the neck go into the arms and legs, so the muscles in the arms and legs can be affected too. As I said before, any of these things can really come from other problems also, but they're notorious for coming from chiropractic problems. So that's pressure on the joints, which when you move, you'll feel it more in the same spot. Pressure on the muscles, which when you move, you'll feel it. It might get a little bit bigger, a wider area where you feel discomfort. Or you might have weakness or incoordination if it's in the muscle. And it could be in the nerve, in which case some nerves are well known to be affected by chiropractic problems, like headaches, nerves that cause headaches, nerves that cause the sciatic nerve, nerves that cause numbness and tingling in the arms, legs, hands and feet, fingers and toes. And then there are nerves that are not so well known, but they go everywhere, and so you don't really know whether or not they're going to be affected or how much they're going to be affected. So I hope I gave you some insight into what a chiropractor can do for you. There's many chiropractors have websites in your area. You can go to them and look and see what they say. And maybe it'll be helpful to you either now or in the future for yourself or for someone else you know. Thank you.